All right, I'm gonna walk out here in the audience a little bit just to get us started. I wanted you all to think about this $100 bill as being the total health spending 25 years from now. So this is everything. This is all the preventative measures. This is all the diagnostic tests. This is all the doctor's visits and the follow-up visits and all the treatments. And that's to cover all the diseases, thousands and thousands of diseases. So now I'm going to ask for a couple other folks in the audience to help me illustrate this. So Anne, you're going to be neonatal diseases. Neonatal diseases get a penny out of that $100. Wendy, you're a little bit better here. You have lung cancer, you get a quarter. Elaine, you're over here. You have later child health. You get a nickel. Isabel, ischemic heart disease gets $1. So you can see it kind of gets parceled out over thousands and thousands of diseases. Meanwhile, who's the real winner of all this spending? It's dementia. So dementia, I'm going to go all the way back here and give it to Michael. Michael, could you stand up? Michael's the winner. $10 out of every $100 goes to dementia 25 years from now. But think about now all the things that aren't covered. The rest of you in the room who care about road traffic injuries and gun violence and diabetes and cardiometabolic and all these things, you have to divide all the rest of that money up, just like I was doing there. And it doesn't have to be that way. We can do what Allison was saying just a moment ago and think about spending as investing. How do we invest and take advantage of what Tarek talked about earlier, this neuroscience moment that we're in? Invest in early diagnostics, invest in new treatments, invest in preventative measures to transform what we're doing around dementia, which is right now spending that $10 at the very end of life when it's often far too late. So if we can shift that mindset, and Kate's going to talk about that, how we can start to shift that mindset into thinking about what we do now to transform the future and to make sure that not only is dementia taken care of, but that all these other things we care about have more funding and more opportunity.
So we have twin goals today. I can tell this is a very action-oriented crowd. And so we framed our goals in action speak. The first is to highlight the health, economic, and societal impact of inaction on brain disorders. And the second is to describe a pathway for generating the evidence that's needed to empower action. And this is where we see our role at the Institute for Health Metrics and Evaluation. Now, to keep us focused, since we only have about 15 minutes left, we're going to focus specifically on Alzheimer's disease and specifically on the early detection of Alzheimer's disease. I'll present some findings from my colleagues at IHME on the current and future burden of disease, of Alzheimer's disease and other dementias, expressed in both health and economic terms. We'll talk about how we can quantify the potential impact of intervention strategies, and then we'll close with some critical questions for stakeholders in the brain economy. That's all of you. First, a bit about IHME. We are an independent academic global health research organization based at the University of Washington in Seattle. Our teams focus on rigorous and comparable assessments of the world's most pressing health problems and evaluate strategies used to address them. And some of the key research streams that come out of IHME include the Global Burden of Disease Study, which many of you in the room are familiar with and cite frequently in your papers. Also, our future health scenarios platform, and lastly, our disease expenditure studies. And those are just three of the numerous research priorities that we have ongoing at IHME. Another area of focus for us is our Brain Health Initiative. And along with like-minded organizations, many of you are here in the room today, through our Brain Health Initiative, we have aimed to deliver rigorous and comparable assessments of the health and economic impacts of brain disorders to motivate policy change and mobilize resources. And this work has been made possible through the support from numerous organizations listed here on the slide, thanks to those of you who are here today. And I'll be presenting some work from our Brain Health Initiative in the next few slides. So I think we can all agree that Alzheimer's disease threatens healthy longevity and prosperity everywhere. And in the green trend line in the upper left, we plot the number of prevalent cases of Alzheimer's disease and other dementias globally. We estimate that this has grown from approximately 20 million in 1990 to around 60 million today, and we forecast that this will expand to around 135 million by 2050. Much of this growth can be attributed to population growth and population aging. And if we look at the world map in the upper right, we see that we've plotted prevalence rates of Alzheimer's disease and other dementias, where higher rates are expressed in red and orange shades. And we can see that the countries with the highest rates of Alzheimer's disease also tend to be those with the oldest populations. Now, it's not just these demographic drivers that are leading to the increasing burden and number of cases of Alzheimer's disease and other dementias. It's also increases in exposures to known risk factors. These include increases in exposure to high fasting plasma glucose, smoking, obesity, and others. Now, how do these estimates of disease burden translate into economic terms in terms of the impact on patients, household, the workforce, governments, and health systems? Well, considering just two categories of expense, and that is the direct healthcare expenditure on Alzheimer's disease and other dementias, and the cost of informal caregiving, we estimate that today the world is spending around $500 billion on dementia. We project this to increase to around $2.5 trillion by 2050. We can see in the global map here on the left that per capita healthcare spending on dementia is highly concentrated in high-income countries. This is the legend here is on a log scale. In fact, high-income countries account for 80% of total healthcare spending on Alzheimer's disease and other dementias, while accounting for only 44% of prevalent cases worldwide. We see in the tree map on the lower left, as expected, healthcare spending on Alzheimer's disease increases markedly among the oldest age groups. And on the right, in the stacked bar chart, we show how this spending is allocated across different types of care. So we show ambulatory, emergency department, home health, inpatient, nursing facility in red, and prescribed pharmaceuticals in a sample of 5 high-income countries. And we have generated these estimates for every country globally. We see at a glance that the red bars predominate. In fact, spending on nursing facility care for dementia accounts for around 70% of all healthcare spending globally on dementia. Now, ongoing demographic shifts are going to exacerbate the economic impacts that we see today. In the upper left-hand panel, I show some work from our demographers at IHME. We estimate that the size of the population aged 65 and older worldwide will increase by 350% in the coming decades. As a result, there will be fewer individuals in the working age and caregiver populations for every older adult, and this may push individuals living with Alzheimer's disease into higher cost channels, as providing community care for these patients may become a less feasible option. And we see how this might play out in the lower panels, and here I've chosen a case study from Germany. On the left, we show the transformation of the population structure between 1950 and 2100. This is showing the age groups from birth to 95 and older at the top of the y-axis, and we see that over time there are far fewer individuals in the working age or caregiver population for every older individual. Concurrent with this, we see what we expect to be dramatic increases in direct healthcare expenditures over time. Now, countries and healthcare systems are unprepared for these challenges. Infrastructure is in danger of being overwhelmed, and budgets are inadequate to meet this need. So to deliver on the promise of the brain economy, we need to demonstrate the urgency of new research, advance scientific breakthroughs, scale up evidence-based interventions, ensure equitable access, transform healthcare delivery systems, and develop thoughtful policy that puts people with brain conditions and their families first. We've heard a lot today already about the need for robust estimates of expected ROI, which can empower action towards these efforts, and that's really where we see our role at IHME. And at IHME, we focus a lot on the impact of interventions across a variety of health conditions. Specifically in the space of Alzheimer's disease, we're thinking about interventions that might prevent, delay, or slow disease progression. I want to pause for a minute and say that we do this either in our existing future health scenarios framework or through custom simulation studies that we conduct in partnership with external partners. And this example that I'll walk through right now is a simulation study that's ongoing, funded by our friends at Eli Lilly. And in this study, we're looking specifically at the impact of the use of blood-based biomarkers to enable early detection of Alzheimer's disease, perhaps even in the preclinical phase. So through our simulation study, we can quantify expected population level impacts in terms of health or economic terms. This includes morbidity and mortality due to Alzheimer's disease under an alternative scenario where blood-based biomarkers or access to effective treatments are available, compared to a reference scenario where these novel interventions don't exist. We quantify economic impact in terms of direct healthcare spending, lost wages for patients, and the cost of informal caregiving. And since we build our simulation framework on top of the global burden of disease study, we're able to take into account competing risks due to all other conditions that affect our synthetic cohort. Now, I want to leave you here with a few critical questions that we need to discuss as a group. Bill, do you want to open this?
Yeah, and I'm going to come back out in the crowd again, see if any of you folks want to weigh in, and I'll just hand you the mic. We have 3 questions here we thought would be good for you all to intervene on here. The first one is, how do we increase investment, like we talked about earlier, in support for current patients and caregivers, but also invest in innovations that may avert future cases? So we have both things that we have to be doing. We have to care for people now, but we also have to think about the future. So any thoughts on what we can be doing as part of this community to make that happen? Oh, okay, great. George, I'm going to bring you the mic.
Two words: Operation Warp Speed. You remember that we were able to develop a vaccine very quickly when you got the public-private sector together with patients. And so we're doing that in Alzheimer's now. But that requires changes in your regulatory system, payer systems, and thinking about disease not as a symptomatic condition, but as a life course.
Great answer. Oh, we have a couple others over here. Okay, Garen.
I think that we are at an inflection point for the ROI of investing in neurotech and behavioral health companies. You've seen Karuna get sold for $14 billion, Intercellular also for $14 billion. This is attracting new capital into this space. And of course, we have a number of companies that are now coming back into the field. 2 things that I would say: 3 years ago, we launched an accelerator. 450 companies have applied. We've funded 37 of them and helped them raise $675 million. One of them's already a unicorn. So this is happening right now. The question is not if, it's not even when, it's how do we do more? Because no matter what we do, if it doesn't go through a company, we're not going to help people directly with the treatments that they need.
Great response, Garen. You had a great.
Thank you. I think that we should make a kind of mindset shift from early diagnosis and treatment to prevention. This is the best way to avoid all this, or at least a little.
I think that's a great point, and I'll just respond to that briefly. At IHME, we recently conducted the most comprehensive assessment of risk factors for dementia to date. Findings from that study will be published on a rolling basis. We've published already on smoking, air pollution, and we've presented in public forums our findings related to the role of depression, social isolation, hearing impairment, and metabolic factors, including high fasting plasma glucose, high systolic blood pressure, and high BMI. So totally agree with your point that if resources are finite and must be allocated judiciously, prevention should be the way to go, given that we know that many millions of individuals worldwide are already somewhere along that disease trajectory on that journey. And so we do need to come up with solutions for them as well.
Yeah, I mean, keying off that a little bit, many of the interventions are not affordable, even if they're technically cost effective. So how can underfunded systems, as Kate said, systems that are strapped already, harness the potential benefits of what is available in a way that works? Orla?
Thank you, Orla Galvin, European Federation of Neurological Associations. Kate was my first new friend today, and I almost spilled her tea on her, I think, so apologies for that. The very first question was around what can we do with this? And I'm thinking we're going to be in front of several MEPs in the European Parliament in 3 weeks, and maybe please use your slides. Can we please share the data of the IHME as much as possible? Because decks like this are actually fantastic, and whatever we can do, and if anyone else has similar data for neurological conditions, please send it on because we can get it in front of the decision makers. Thank you. And that's a big request. Please, please, please.
Yeah, of course, yeah, we'd happy to share the deck with anyone who wants it. Over, great.
Hi, thank you. I'm Dr. Ernest Barthelemy. I'm a trauma neurosurgeon and a public health researcher. The Lancet Commission recognized traumatic brain injury formally as one of the 12 risk factors for dementia only just a couple of years ago. However, when I'm trying to understand the global burden of traumatic brain injury, if I go to the global burden of disease data, I can't find that diagnosis, right? I can find trauma and injuries, and I know a lot of them are causing traumatic brain injury, but I have no clue what proportion of that, trauma and injury box is contributing to the TBI. Similarly, my lab recently published some work out of the All of Us research database. We tried to find the traumatic brain injury diagnoses, and only came up with a couple thousand patients. So we had to sort of take a few steps back and think about how are clinicians documenting brain trauma. And with our expanded definition, we found over 10,000 cases in the 2022 version of that database. So I think there needs to be an overhaul, both on the EHR side as well as the public health research side, to really understand if we're going to focus on something like prevention. We know brain trauma is triggering some cascade leading to dementia. So how do we do a better job of identifying patients who have experienced a brain trauma, make sure they're not progressing or that we're slowing down their progression towards dementia, as well as, we heard Dr. Rousseau speak earlier about how many people are dying from traumatic brain injury, 6 million every year, the number that died in the whole COVID pandemic. So we really do have a silent pandemic on our hands that could be a very actionable opportunity to reduce the burden of dementia.
Yeah, thanks so much for that comment. And I'll say that the good news for you is in the Global Burden of Disease study, we do quantify moderate and severe TBI. It may not be available in a publicly accessible tool, but it is available to us, and we do utilize that information. And so we should follow up to make sure that you have access to those types of talking points to make your case. And secondly, we did include TBI in our assessment, that recent assessment I mentioned, looking at dementia risk factors, and did find that there was credible evidence linking the two in a causal manner. So we'll be looking forward to publishing that as well.
I think we are at time, and so I just want to leave you with thinking about the last question, which is just that delayed ROI may discourage investment in prevention and early identification of Alzheimer's disease. How do we mitigate that when ministers of finance want short-term wins? So just think about that. How are we making the case? Some of you had some ideas for making the case, but how do we get the people with the money to actually think about this as a winning investment for them? So thanks, everybody, especially thanks to Pavel here and Harris and Kana and the rest of the hosts. We really appreciate being part of it.